Hello, everybody, and welcome to this week's episode on Fit as a FIDDLE. I have an old friend on the episode today, Joe Lipsky. He is a doctor of physical therapy. We studied in the same school at Columbia University and graduated in the same class, so it's really cool to reconnect with him. He currently is the head of client care at Reload, which is located in New York. He is also working on co-authoring a book that is titled Trust-Driven Care with Dr. Josh Setterly. Did I say that right? Yep.
Yes.
And he is fantastic because if you follow any of his work on Instagram or really know anything about Joe, he's all about patient outcomes and really about delivering quality care, which you would think is our primary goal for a physical therapist and healthcare in general. But I think it takes a special kind of quality in a person to really mean it. And so Joe and all the work that he does and everything that he puts out into the world really emphasizes this a lot, and especially also because he's co-authoring a book about it. So I am super excited to chat with you today, Joe. Welcome to the show.
Thank you, Sneha. First off, it's so good to finally reconnect, especially because we're trying to accomplish a very similar mission and just help people and serve people that aren't being served. So it's just good to talk to you and good to see you.
Yeah.
Thanks for having me on. I really appreciate it.
Of course, my pleasure. So tell us a little bit about what brought you into physical therapy and specifically to the work that you're doing in Reload right now.
For sure. So, growing up, I was really into sports. Honestly, I didn't really care too much about school, but my parents were great parents, and they said if I didn't do well in school, I couldn't play sports. And that's kind of really how I found out about physical therapy. I was playing soccer in college. I had an ankle injury, and then I saw a physical therapist, and I'm like, you get paid to work with athletes? Cool. Okay, sign me up. So I majored in psychology in undergrad because I was always interested in how people communicate and how people think and what drives people. And then, I realized I just didn't want to do a desk job, and working with athletes sounded fun. So that's really what led me to PT school. Thankfully, I got my stuff together and somehow got into Columbia. But when we were at Columbia, I started doing a lot of outreach, and I started trying to learn more about what life is like as a physical therapist. I probably should have done it more before school, but I started to realize that the system is not necessarily built to really help people. It's built around, more financial and business incentives than it is people, right, and outcomes for our clients. So once I realized this, my goal was to be able to come out of school and provide people the care that they need, give people the time that they need to feel heard, give people the time to share their stories so that we could not just help them exercise, but help them understand themselves more and how exercise is a long-term solution for them, not just a quick fix. So while I was in school, I was lucky enough to meet, my colleague and the founder of Reload, Ryan Chow. And he really paved the way. He started Reload. I joined him right after finishing up at Exos and right after graduating from Columbia. And he wanted to do the same thing. We wanted to provide a place that put people before profits and just help people and figure out what is the best way to help show our clients that you don't need these quick fixes. You don't need medication, surgery, injections. You don't need these fancy tools. You just need to learn about exercise and learn about what living a healthy, active life is really about. So we kind of just follow the World Health Organization's SNAPs, smoking, alcohol, physical activity, social interaction, nutrition. And, we follow the World Health Organization's recommendation of 2 times a week of resistance training and at least 150 minutes of moderate to vigorous cardiovascular exercise a day. And that's kind of where I am now. And then, with the book, the book is really just about what I do here at Reload and how we try and focus on communication and talking to people, not trying to talk to a diagnosis or anything.
Yeah, I love that. And I really resonate with the piece of not knowing going into physical therapy school that the general world of PT and healthcare in general is not really what we would have imagined, because we go in for the right reasons. We want to go in to help people. And you work in these clinics that they're doing the best they can in some cases, but it's not about what does a patient really need in that day. It's what's about the billing and scheduling and squeezing another person in, and it's all about, like, you know, in every industry it's about the money, and we get there, but we get that, but in healthcare it can't, and it is, but it shouldn't. And I feel like there are a lot of ways to maximize, you know, making sure that people are earning a decent wage and living a normal life. At the same time, we're really focused on the patient outcomes, and that the patient outcomes are what drives in the profits coming in. I'm sure you kind of agree with that. And I'm on the same page with you that while I was in school, I did not recognize this as much until I started working in clinics as well, and really seeing it for the way that it was. Did you have very specific like clinical rotations or places that you feel like you've done any of your clinical observations in where you felt like things really worked out well or things did not work out well?
Yeah, I would say my first clinical rotation I had here in the city was a good representation of what I didn't want to do. And it was a group of people that they meant well, but they were stuck in this system that didn't allow them to provide the care that they thought people needed. So over time, I feel like they just kind of conformed to try and survive.
Mm-hmm.
And then thankfully, my last experience out in Arizona at Exos, I saw, it was predominantly given to the higher level athletes, where I think, what we're doing at Reload is to try and expand what they're doing really to the general population, is they're combining this model of having people come in for physical therapy because they feel like they have this pain or injury stopping them from doing something, or it's affecting their mental health, and show them that, like, you actually just really need to train and exercise. It's just all about finding the right starting point for you. So I saw that out at Exos, and I'm like, I mean, these guys are really doing something right out here. I think just the general population needs it. It doesn't just need to be for high level athletes.
Yeah, I hear you. And I think it can be tricky, right? I think the big elephant in the room is insurance often. And so that can be the piece that, you know, really complicates everything a lot. Um, what do you feel like as clinicians who are working in the system, and we can't necessarily get out of the insurance models in general? We are in an environment where we are somewhat dictated by insurance companies, reimbursements, and things like that. If you're stuck in that, because the majority of physical therapists work in clinics, the majority don't work as an independent practitioner or in out of network situations. So what can you tell people who are in that situations as physical therapists to improve the quality of their care in those constraints?
Yeah, it's a great question. So our mentor here at Reload is Dr. Craig Liebenson. He teaches for first principles of movement, and he's really like our North Star. And I think the biggest thing that he showed me was he opened up my eyes to the public health data that's out there, and the big picture research about what's going on. And it really makes what little changes we can make in the clinic very actionable and have big scale change. So, for example, whether you're working in a clinic, whether you're trying to give advice to your parents, whether you're trying to give advice to your friend that you see at a party that you haven't seen in 2 years that's dealing with back pain, what we see is that low back pain is the number one cause of disability in the world, right? 4 out of 5 people in their lives will experience low back pain. So it's nothing to joke about, right? Like, no, low back pain is serious. But the things that we've found to reduce the incidence of low back pain is just consistent exercise. It almost doesn't matter what kind of exercise you do, as long as you consistently do it at least twice a week over the course of 6 months, right? So in whether you're in an outpatient clinic, whether you're in an in-network clinic, whether you're in a hospital, helping show people how to exercise consistently and just removing whatever barriers you can will lead to so much better outcomes, right? looking at like obesity rates, like we're approaching 40% obesity rates in the United States. Like 80% of people don't meet physical activity guidelines. And a lot of this is just due to misinformation, right? So even if you only have 15 minutes with someone, what's one thing that you can open their eyes to? Can you just dispel a myth that, you know, arthritis is not wear and tear, that running is not bad for your knees? You know, the oldest form of exercise is walking. On average, if you were to walk for an hour a day, 5 times a week, you'll burn over 1,500 calories. If you change nothing, right, you'll probably end up losing 0.5 pounds a week. I think that's like astonishing. And those are very simple ways to start to make a difference, no matter what setting you're working in.
Yeah. I actually really loved, I think over the last week or two, or maybe even a little longer, I've seen some of your Instagram posts talking about removing the barriers and making exercise accessible, which sounds like such a revolutionary concept in these days and times, when exercise means signing up for expensive classes and subscriptions, and means crazy equipment and building home gyms that are like thousands and thousands of dollars, and means that you have to physically leave your house or leave your space and travel for X amount of time to get to another place. I'd love for you to rant about that. Tell us what you think.
Yeah. And look, the fitness industry is really good at helping people that don't need the help, right? If you look at a lot of the people that consume fitness, you know, you can subspace fitness into like wellness. If you look at a lot of the people that consume wellness services, it's people that already exercise and that already are pretty healthy. Yes, they deal with orthopedic issues, but I'd rather have someone dealing with an orthopedic issue than, you know, a cardiovascular issue or something that's related to a more chronic disease any day of the week, right? And I think we share that. So what I'm just trying to do is show people that you don't need anything, right? Like just go outside, you get sunlight, right? You get natural air, you know. I think the craziest statistic was Adam Grant recently shared a study looking at over the last 2 years, on average, how much time has the average American got back, not having to commute to work, having to work from home during COVID. And on average, people have gotten back an hour a day. But less than 10 minutes of that time is dedicated to exercise.
Yeah.
So the solutions that we're trying to provide right now in the fitness world are not meeting people where they are, right? We thought before the pandemic that if everyone just had a little bit more time back in their day, they'd be able to exercise. But that's clearly not the case. Clearly, like the evidence is showing that people have more time, but it's not being dedicated to exercise. So one, how can we educate people on easy ways to get more exercise in? And two, how can we meet people where they are? If they're at home and they don't have a fancy gym, like you said, if they can't afford, you know, one of these high-end at-home fitness equipments, what are things that we can do to get them into exercise that makes lasting change? Walking 10,000 steps a day has drastic impact on life expectancy and health span, right? Health span being years that we live later on disease-free. Also, just look at something like push-ups. NYU did a study that was published in, I think, JAMA a couple of years back, looking at among active males, what is your risk of cardiovascular disease in people that can do push-ups? They found that if you can do 40 push-ups consecutively, you have a 90% decreased risk of cardiovascular disease compared to people that can do 10 push-ups. You don't need any equipment to do push-ups. It's free, you know, just hopefully you can go to my Instagram page and I have like 17 different videos of how to do a push-up, how to scale back a push-up if you can't do a push-up, what to do if your shoulder hurts if you have a push-up. Super simple.
Yeah, I totally hear you. And I think that the piece to take away for listeners right now is that we can make fitness complicated and sexy and all these other things that make it look like glamorous and need all of this stuff behind it, which often for the majority of people takes away from the actual experience and the health benefits of getting stronger, more flexible, building more endurance and all that stuff. or we can just break it down into bite sizes and make it so that you can have fitness and wellness at every aspect of your life, no matter where you are, no matter how old you are, and no matter, you know, really wherever you wherever you fit right now on the spectrum of fitness. One of the things, Joe, I've been telling a lot to my patients very recently, and this is particularly to my postpartum moms, or the ones that have multiple children and have a lot to do in terms of childcare, is they're like, you know, Sneha, I really think this like 10-15 minute routine that we've come up with together has been so helpful. It's just gotten really tough, and it's been like 30 days. I haven't been able to do anything, and it's just like, it's hard for me to get into this. I know it's only 10-15 minutes. I know it's easy. We've done it all together. It's not like I don't know how to do it. I just can't get myself to do it. It's just too much going on. And one of the things I've been saying, which has actually apparently been helpful for a couple of people, is the idea of negative space, which is time that you think you're doing something where you can actually be also thinking about exercise. And this is the time that I mean, which is waiting for your coffee to brew, or, you know, waiting for the microwave at home, or your kids going to the potty and you have to wait for 2-3 minutes outside before you have to help them out. Those kinds of times where it's just 2-3 minutes. It's not a lot of time, but you can get an entire set of anything. It could even be a single imbalance of like one leg marched up to 90 degrees and then breathing and engaging your core, and then switch and do that for 30 seconds on both sides. Or it could be wall push-ups, or it could just be body weight squats, or it could be just doing little trampoline bounces on your floor if you're not living on a floor that has somebody else living underneath you. But it's just these small things where you just activate your muscles, get your heart rate up, think about your body, and just move, instead of scrolling through Instagram, or instead of kind of just like putting away something that doesn't need to be put away and organizing something that doesn't need to be organized. I don't know. I'd love for you to touch on maybe some of the tips that you provide for people as well in your work. I know you have tons of tools up your sleeve because I see you posting about them all the time, just to help people get engaged with their bodies a little bit more.
Yeah, I never thought about the term negative space. I think that's genius. That's so smart. And you phrase it in a really good way. And I'm definitely going to start using that too.
Do it.
I'm big on lifestyle, right? So when we start to break down people's lifestyle, I like to reference the book Atomic Habits by James Clear. I just think it's an awesome resource. And how do we form habits then? You know, the first step to forming habits is to identify habits that we don't want, right? Like you said, like scrolling through Instagram, right? How can we bring awareness of those habits that take time away from other valued life activities? So, my recommendation is to do what James Clear references habit stacking. So, for example, if you like scrolling through Instagram, why don't you do like a little squat while you're scrolling through Instagram? Or, set a timer for every, you can use tracking on your phone. And I try to have people track how long they stay on certain apps. If you're on Instagram for, call it a total of like 2 hours a day, could you take out 5 of those minutes and do 10 push-ups? In addition, instead of giving people like at-home exercises in terms of like 3 sets of 10 or like 2 rounds of 5, I give people it in terms of minutes. So, this was popularized from CrossFit, the whole EMOM type concept. So I give everyone EMOMs. And I think when people think of things in terms of time, it's going to take out of their day. It's much easier to block it off. So I'll give people an EMOM, and, I work with a lot of people that are very busy. So instead of giving them 5 sets of 10 push-ups, I say 5 minutes every minute, you're going to do 10 push-ups. And then it organizes like how long you rest for. You can get a sip of water after your 10 minutes. You can even scroll through Instagram for 40 seconds. But, when that minute comes, you got to rep out another 10 push-ups. And before you know it, if you do 5 minutes a day of 10 push-ups every 5 minutes, by the end of the work week, you've done 250 push-ups. It's a lot of push-ups, so starting to reference things in terms of time and how you can accumulate stuff over time, I think is really powerful. Because it's, I think we all get so stuck in the weeds of like, where are we today? How can I get in shape today? At the same time, like, oh, I didn't exercise today, I'm going to lose all my progress today. That's not how it works, right? You don't get in shape in one day and out of shape in one day. It's looking at the totality of a year. It's looking at the totality of months and years. So breaking it down in that concept, I think, is really powerful and empowering to people.
Yeah,
That's like my
totally.
go-to first one.
Yeah, yep. I like the thing about breaking it up in time. The times that I use this, like instead of giving somebody 3 sets of 10 and tell them to do it for a certain amount of time, is for the patients that I realize after like the third visit, they're like, it took me 45 minutes to do my exercise. They have like 3 exercises. They're like, it took me 45 minutes. I'm like, what are you doing? We went over this together, So I'm like, hold on. Whatever you're doing, just do whatever you can in 5 minutes. Just stop, set that timer, and then that's it. I think it's especially useful for those patients, but you're absolutely right. It's for everybody because everyone's busy. Everyone feels like, exercise can be time consuming, and especially PT exercises. I've been trying to push people away from saying that because I'm like, your PT exercises are your exercises. You brush your teeth every day, right? It's like regular dental health. Your PT exercises are just the way you're moving your body in a way that's conducive and personalized and customized for whatever's going on in your body. So don't think of PT exercises separate and then movement and fitness separate. It's like all well-being and everything that you need to keep up with. I see your eyes are perking up, so I'll let you comment.
Well, yes, like, so, we teach at Reload that, physical therapy is just training when you're injured, right? So if you can kind of like take out that very dichotomous mindset of like, you have your physical therapy and your training, and they're just the same thing, it opens up so much more time, right? It's like, oh, okay, not only am I trying to help overcome this injury or this pain that I'm having, I'm also moving towards my more aspirational goals, whether it's like losing weight, building muscle, getting stronger for longevity. I want to run a 5K for the first time. Doesn't matter.
Yeah. And for listeners, I mean, who maybe, if you're not familiar with physical therapy or what physical therapy exercises are, it all just depends on what the person is going through, right? It's a highly, highly customized, and physical therapy is not equate to exercise either. Physical therapy is a combination of treatment methods and different kinds of modalities and different kinds of manual therapies and functional training and mindset shifts and education more than anything. And exercise, in the sense of how do you move your body in space, is one piece of a very large puzzle that's all within the bandwidth of physical therapy. And now when you think of that as exercise, those exercises really are there to help catapult you in whatever direction that you want to move in. And so somebody who's coming to Joe or I and like, hey, listen, let's just say I have an ankle injury. And what I just need to do is be able to climb the flight of stairs to get to the subway in order to get into work. And then I'm sitting all day and then I come back. My favorite method of exercise is swimming. It doesn't really affect me so much. My goal is to just be able to walk up the stairs pain-free. Their program, what we do by evaluating their entire musculoskeletal system, taking a look at what their weaknesses and tightnesses and kind of restrictions are, is customize something for that goal to make sure that they have achieved that. And then we want to work on prevention, right? Like there's a maintenance plan and there's prevention. If you're prone to ankle sprains, more likely you're going to have another one and roll your ankle again, right? Especially if you're not having enough proprioception, is like the ability to sense where your foot is in space, that gets lost over time with repetitive ankle sprains. Now that person looks very different from somebody who's like, hey, I just sprained my ankle and I need to run the half marathon. It's coming up in 6 weeks. And that whole plan just looks different. It's nothing better, nothing worse. It just looks different, right? So Joe, why don't you touch a little bit on how do you talk to patients and customize things for their very specific goals? And then how do you communicate that with them in terms of long-term care and prevention as well?
Yeah, and really well said. I think where a lot of people are failed by the healthcare and fitness industry is we try to shove them into pegs, right? We try and say like, oh, this is your diagnosis of Achilles tendonitis, so you're going to fit in the square peg of Achilles tendonitis. But everyone is different, right? Yes, we have standards, and yes, we have averages, and people fall under a bell curve, but at the same time, no one is average. So how can we, again, just meet people where they are And even if they're going to get the same exercises as the other guy that has the Achilles tendonitis, their understanding of what they need and why they need to do it is totally different, right? So the why behind the what of the exercise is really, I think, where the personalization will occur. Understanding, okay, what's this client's perspective in front of me, right? What do they understand? What are their beliefs? What are their fears? What are their worries? What are their concerns about these exercises because of their past experiences? How can we identify where they are? And how can we start bringing them on this journey of like, these are the exercises you need. We'll show you that they're safe. We'll show you that they'll get you results. And we'll show you that these incremental steps lead to progress over time for you to get back to your goals, whether it's going up the stairs, whether it's going and running, right? I mean, taking the ankle injury or the Achilles tendonitis, right? One thing that's been shown to decrease, occurrence of Achilles tendonitis or even help people recover from Achilles tendonitis and ankle injuries is doing sets of single leg calf raises. Like, can you get to 30 reps of single leg calf raise? Doesn't really matter what your goals are after that, right? You just got to be able to do those 30 single leg calf raises. But then how you position it to everyone, that's really where I think the gold is.
Yeah. And that's all about how you communicate with patients and explain the exercises. And it's not just a stretch because I gave it to you, but rather we're achieving something out of it. And this is how. And I think that's really the magic behind it all, is right. That's just it. It's patient communication. How do you explain things to people well?
Yeah. And, that's a core philosophy of ours at Reload. So all of our evaluations at Reload are 90 minutes and they're done with a physical therapist and a trainer at the same time. Because similar to how professional athletes are treated and they have a team, we think that everyone else needs a team and that team needs to be on the same page. And this team approach creates this client-centered model, right? Where we have each person centered around the client and they're in the center. It's not this diagnosis and then everyone's on the outside trying to figure out the diagnosis, right? And then, this evaluation model that we have allows people the time to tell their story. Not the short version, right? We want the long version. We want the details. We want to know how you feel about things. We want to know what's worked, what hasn't. Why do you think it worked? Why do you think it hasn't worked? Right? Because your beliefs about exercise are probably more important than the actual exercise I'm even giving you.
Yeah, absolutely. I'd love to dive a little bit into the book. I know that we are probably touching on a lot of the points that you're bringing up in terms of patient-centered model, but is there something that you would like to share about, that you're allowed to at least, about the book that's coming out that you're co-authoring, and just to let the listeners get a little excited to go out and purchase?
Yeah, for sure. I appreciate it. So the book's called Trust Driven Care, and it's, in my opinion, really based on what I'm doing at Reload. So at Reload, I'm, as you said, the head of client care. And my job is really to make sure that each person that comes into Reload is in front of the people that they need and then gets into the service that best fits them, right? So if you look at the healthcare system right now, a lot of the time the patient kind of has to navigate what they need, who they need to see, why they need to see this person. And that's a high value decision in terms of figuring out what is the service that you need to go to, because there's a lot of information that goes into it, right? So that's what my job is to, from when the client inquires to Reload, what is your story, right? Where have you been? What are you trying to do? And I take all this information, I talk with everyone on the phone before they come in, and I make sure that they get into the right service, whether that's physical therapy, whether that's one-on-one training, whether that's our group classes, or maybe it's going to see someone else like yourself, right? We get a lot of people that are trying to exercise after having a child, and we think it's imperative that they see a pelvic health therapist first, because there's a lot of stuff that we're just not trained to do. And that's really what my section of the book is about like practical applications to just client-centered communication, because I'm not really providing physical therapy. I'm not doing a lot of the giving you specific exercises and figuring out your really big issue. I'm more just, I want to put you in front of the right people that can do what they need to do. and help you from there, right? So I'm like the guide during your client journey or your patient journey, right? I want to guide you from where you are now to where you want to be, whether that's going from physical therapy, then you start feeling better and you want to go to training. I'll help you figure out what that next best step is. Maybe it's a group class. Maybe it's starting with one-on-one. Maybe actually you need to go see someone else to get cleared and then come back.
Yeah.
And I think the way that it's done and the way that it's handled is very intricate. And that's really what I outlined in the book, from each step of, someone inquires that they're interested, or what's your messaging like to, build awareness about what you're doing. How are you handling conversations before they schedule? How are you building trust from the very beginning so that when they come in, you can ask high trust type questions in a typically low trust situation, right? Like when people first enter healthcare and they first get into the doctor's office, it's such a rushed visit that sometimes doctors need to ask patients really personal questions really fast. And it's like, whoa, 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 I don't even know you, right? Like I get you're an expert here, but I kind of want you to understand me before I just start disclosing really personal information about myself. And, frankly, like fears that I haven't really talked to about many other people. So how can we build more trust up front to help ease that process as we go?
Yeah, that's beautiful. And I think that that role is so crucial. And I think a lot of facilities don't have that at all. I think that's very unique to Reload, at least from what I understand. I think getting that referral, getting sent to the right person can often just be like such a game changer in patient care. And they have this model in hospitals for some part, right? So like somebody who evaluates and say you're going to subacute, or you're going to, you're staying in acute, or you're going to skilled nursing facility, you're getting discharged with home care, you're getting discharged with outpatient. Like there's people who kind of look at this patient's case and really understands it comprehensively, takes a look at all of the notes from neuro and cardio and all of the different services that they received, and then decide a plan of care. And we don't have that a lot in outpatient. And in a lot of senses, I think it can be even more complicated, because it's not all like some person's not going to, one care provider who even knows or works in the same facility, right? So I think what you're doing is so helpful, because it's a healthcare provider who's guiding them in the right direction. And so I think that's invaluable.
I appreciate it. Yeah, I think, having the knowledge of the physical therapy and like the medical background, having the training background as well, allows me to make decisions that other people aren't necessarily able to make.
Mm-hmm.
And that's what the book is going to break down a little bit, is how do we make those decisions? Because
Yeah.
not even how you make them, actually, how do you frame it? How do you understand where the patient is coming from so that you can even make a recommendation, right?
Yeah. Yeah. Well, Joe, is there anything else that you really wanted to touch on today? Because I think I could keep talking to you for a very long time, and we do need to touch base offline again and chat some more. But do you have something that you want to share with our audience today related to, patients before profits, the idea of patient-centered care, that you'd like everybody to know about?
I just think that in the healthcare, if you look at healthcare and you look at the scoreboard in healthcare, um, we spend over $600 billion a year on chronic disease. And currently, 2/3 of all disease are lifestyle related. What we're doing in healthcare isn't working, and it's largely due to putting profits before people. So if you're looking to make a change, or you're looking to help people make a change, just start simply putting people before profits. And again, that's not to say don't worry about putting food on your table, but there's just so many people out there that need our help that if you just focus on giving really high quality care, a lot of the other stuff that we worry about, like on the business end, will take care of itself.
Yeah, I hear you. I hear you. And I think that sometimes it takes a little bit of patience, but I am completely on board that if you just provide that quality care, people are going to come and receive the service, and they're going to appreciate you for the work that you do. And it's just going to be such a better way of treating, and it's such a better way of receiving care too. So thank you for putting that information out in the world. Thank you for the book that you're writing. Excited for it to come out. Do you know what month or what year it's set to release?
We're hoping to have the final draft done by the end of April.
Nice.
So we'll hopefully be finished editing sometime during the summer. This is my first time co-authoring a book and working with like a publishing team. So
Yeah.
I
Yeah.
have a date in my head. I don't know if that's realistic. I'll let you know.
Okay. Well, we're excited and we'll definitely reach out to our listeners and maybe have you back on the show after it's released to talk a little bit more about it too. But thank you so much, Joe, for your time. Thank you for the work that you do. And thank you for enthusiasm in helping patients heal and recover.
My pleasure. Thank you for having me on.